Let's talk about a crisis that's hitting the heart of American healthcare. It's not a medical problem, it's a math problem. We're seeing rural hospitals shut their doors, not because they aren't providing great care, but because the system they operate in is fundamentally broken. But the good news? It has a solution.
Right now, as we speak, more than 600 rural hospitals across the United States are on the verge of closing. So you have to ask the question, right? Why? Well, the answer isn't in the emergency room. It's buried deep in the back office. It turns out the real disease plaguing our healthcare system is just staggering administrative waste. It's a problem so outdated, you could say its mascot is the fax machine. Yeah, you heard that right.
$1.5 trillion. That's how much money is wasted every single year on paperwork and administration in U.S. healthcare. We actually spend more on billing and bureaucracy than we do on treating cancer.
The healthcare industry, today, still sends 9 billion faxes every single year. And this is the number that really matters. 30 cents of every single dollar that flows through healthcare goes to these administrative costs. For a small rural hospital, one that's barely surviving on a razor-thin margin of, say, 0.3%, that 30% burden isn't just a problem. It's mathematically fatal.
You know, this waste isn't just happening by accident. It's the direct result of a huge failure in our healthcare infrastructure. What we have are two completely separate worlds that, incredibly, just don't talk to each other.
On one side, you've got these amazing modern clinical systems. But then, on the other side, you have the payment systems, which are completely cut off. So to actually get paid for the care they provide, a doctor has to print out those electronic records and fax them.
And look, this isn't just about money or inefficiency. It's about people. Take the story of George. He was a Medicare patient, and a life-saving cardiac device he needed was held up for 6 weeks, all because of a back-and-forth paper trail of faxes between his doctor and his insurance. His collapse, the emergency airlift, the ICU stay, all of it was completely preventable.
Okay, so that's the problem, and it sounds pretty grim. But here's the pivot. There is a solution. And it's not about throwing more money at the problem with subsidies and band-aids. It's about fixing the underlying issue by building permanent, modern infrastructure.
I love this analogy. We can keep pouring money into propping up a broken, outdated system. That's subsidizing horses. Or we can make a smart, one-time investment in the infrastructure we actually need, in the highways, and solve the problem for good.
So what does this highway look like? It's basically a three-way hub, a single universal network that finally connects everyone. We're talking every provider, from the smallest rural clinic to the biggest hospital. Every payer, commercial insurance, Medicare, Medicaid, the VA, all of them. And for the very first time, every single patient.
The easiest way to think about it is like a visa for healthcare, right? When you swipe your credit card, there's this incredibly complex transaction that happens between you, the store, your bank, their bank, and it all happens securely in a couple of seconds. We need to bring that exact same seamless, universal connection to healthcare administration.
So, what does this actually look like in the real world when you flip the switch? The impact isn't small, it's not incremental, it's absolutely transformative.
I mean, just look at these numbers. A prior authorization that used to take a week of playing phone and fax tag now takes 30 seconds. The number of insurance claims that get accepted on the first try, it jumps from a shaky 75% to over 95%. And here's the most important part. That fatal 0.3% operating margin for a rural hospital becomes a healthy, sustainable 3 to 4%. Suddenly, the math actually works.
And you know, maybe the best part of all this is that it isn't some custom one-off solution that only works in one place. This is a replicable blueprint. It's a model that can be picked up and deployed in any state that's facing this crisis.
The financial case is just undeniable. For every single dollar a state invests in building this kind of infrastructure, it saves between $8 and $12 in administrative waste from federal programs like Medicare and Medicaid alone.
And what happens after it's built? Does it need more subsidies? Nope, the whole system pays for itself. It runs on a tiny little utility fee of just 0.05% of revenue. That's a tiny fraction of the money it's already saving everyone. It's a self-sustaining solution.
Which really brings us full circle. We know what the problem is. We know it's not about the quality of medicine. It's about broken math. The technology to fix it exists. The blueprint is proven. So if we can save these vital community lifelines just by solving a math problem, what are we waiting for?